top 3 things you're looking forward to, top 3 things you're anxious about because you have that perspective of seeing recoveries. Right. And then we'll end with my favorite question.
So my wife now is 8 months post-op, and it's kind of interesting because the change in the face is fairly substantial. And now we fast forward 8 months and things have settled down, and we started looking at some pre-op and post-op photos, and we really realized how her face looked pinched in. And then we started looking at some of my photos and realizing, I need to do this. Not only, so I guess the things I'm looking forward to is the airway, obviously.
For sure.
And hopefully getting off the PAP. I mean, I tolerate it pretty well, but I like to do outdoor things, and I went, last weekend I was camping in the Grand Canyon, and I can't obviously backpack with my PAP. And
it's nice not to be dependent.
And my sleep wasn't great.
Yeah.
And so I'm looking forward to that. I think aesthetically, I think it's going to look better.
It's going to look awesome.
My son, one of his biggest things is like, I like the way I look now. I got a strong jawline.
That's great.
My mid-face isn't pinched. And then I guess the other thing, if I have to pick 3 is to be able to really complete this journey as a patient, and that's going to help me as a practitioner in helping my patients. As far as the things that I'm worried about, my son and my wife both had their surgery on the same day, one at 8 o'clock, one at 10 o'clock. And so I got to see kind of
you were the most stressed person in the world that day. that
was tough, and they were in separate rooms overnight, and I was bouncing back and forth between. I
remember that.
And I mean, and I know you're straight with your patients. The first week sucks.
That's all I always say. First week sucks.
So I'm definitely a little bit worried about that. I mean, I'm looking forward because I know that my mid-face is deficient, and so I do think bringing forward, I think it'll help balance my nose, and it'll get rid of that concave profile that I have. But I am worried about going back and seeing patients. I've got 2 weeks off, and so and I know there's going to be a lot of swelling, and the way as a periodontal practice, I see a lot of I've known a lot of my patients for a lot of years, and so it's going to be probably a lot of conversations of what happened, which will be probably a little uncomfortable for me, but then at the same time, as I'm thinking about it here, that's a good conversation starter for. Absolutely. I'm doing this because of my health, and I mean, so many of my patients need it, so it can be a good kind of starter conversation. And then the other thing is probably the numbness, and I mean, it just.
How long will it be?
And so for my wife, she's got some numbness on half of her tongue still, and definitely the chin area, and then my son, it is numb in the chin, and it's there's definitely some starting to come back, but it's slow, and the palate. Yeah, the palate usually takes a year. And that one I'm not too worried about. And I told my wife about that because when I go in and harvest a connective tissue graft, I cause numbness too, and sometimes it takes like 9 months, and that's mild compared to what has to be done with MMA surgery.
So we're gonna follow up, obviously, when you're here for your post-op, and feeling up to it. But looking forward to it. I know we're going to do well. I think this will be a huge success for you.
Yeah, I'm
a great message to the world for sure.
I'm excited.
Yeah. All right. Best basketball player of all time.
I mean, of all time, I would say my favorite basketball player of all time is Karl Malone.
Yeah.
I wouldn't say that he's the best, though. I mean, he's among the best.
He's amongst them for sure.
As far as the best, I have a hard time. I go back and forth between Michael Jordan and Kobe Bryant.
Yeah.
And I don't think
that's my 1 and 2 for sure. Awesome. All right. Stay tuned. Thank you for coming.
Yeah. Thanks for having me.
All right. Definitely.